Good morning. Today is Wednesday, November the 25th, and this is our weekly COVID-19 update briefing. Unfortunately, as of today in Bossier Parish, we've had a significant increase in positive cases to 6,034. That's an increase of 610 since our last briefing. And unfortunately, we've had an increase in deaths. We've had 6 more deaths, bringing our total at this point, as of this morning, to 147 in the parish. In the past, the governor has repeatedly stated that should he have an increase in the number of positive cases or related hospitalizations which threatens the ability of our healthcare system to properly respond, it may be necessary to regress to a lower phase of recovery. Unfortunately, that has now occurred, and Louisiana is now experiencing a major surge. Governor Edwards announced yesterday that due to this third surge in COVID-19 positive cases and increased hospitalizations and deaths and the impact of these on our hospital capacity and staffing, the state will regress to a modified phase 2 of the recovery effective today, November the 25th, and this will be in place for 28 days until December 23rd. The governor's proclamation 168 was issued today and is effective today. And we are now in a modified phase 2 of the recovery, and I'll refresh our memory just a little bit on some of the phase 2 guidance, but I recommend you obtain a copy of the governor's proclamation 168 for details. In this phase 2 modified, all individuals at higher risk of serious illnesses from COVID-19 should stay at home, but there are some common sense exceptions to that, but those with serious illness should stay at home. Center for Disease Control defines higher risk individuals as individuals with asthma, chronic lung disease, compromised immune system, diabetes, serious heart disease, chronic kidney disease, undergoing dialysis or liver disease, severe obesity, and those age 65 or older living in a nursing home or long-term care facility. Non-essential business shall be closed to the public, such places as amusement rides, carnivals, amusement parks, splash pads, water parks, trampoline parks, arcades, fairs, festivals, children's play centers, indoor playgrounds, theme parks, concerts, and music halls. There's a lot of emphasis on bar activity, and I'll summarize what is in the new ordinance. No bar with or without food service permit from Louisiana Department of Health shall allow for indoor on-premise sales or consumption of any food or drinks, period. Bars allowed to provide for takeout through drive-through and curbside service include alcoholic beverages. Bars shall be allowed to open for outdoor service and consumption, but seating capacity cannot exceed 50 patrons in total. And there is no standing at these, no standing capacity permitted. Bars that are in a parish where the positivity rate has been 5% or less for 2 consecutive weeks can qualify for open indoor on-premise sales on consumption if the parish opts in, but they got to continue to maintain that 5% or lower positive test rate to do that. Bars cannot exceed the 25% occupancy of 50 persons, whichever is less. Bars may operate from 8 a.m. to 11 p.m. That is no change. And again, no change in that no walk-up service is permitted. You have to be served at the tables. And you have to maintain social distancing, and of course you've got to be of legal age to be in a bar to consume alcohol. Restaurants, cafes, and coffee shops shall be allowed to continue drive-up and curbside service, but not exceed 50% occupancy. And of course social distancing is still required, and the waiting areas are closed except for restroom facilities. Beauty shops, salons, barbershops allowed to operate up to 50% of occupancy, but again, social distancing is required, and making reservations is recommended or wait outside for curbside services. Churches and faith-based organizations are up to 75%. They can remain at that, but again, you have to maintain 75% among households. A little bit different there. And lobbies, of course, and waiting areas are closed except for restrooms. Casinos, racetracks, and video facilities can operate up to 50% occupancy, but with no more than 50% of gaming devices. And again, social distancing is required. Gyms and fitness centers up to 50% occupancy. Again, social distances, waiting areas closed. Athletic events, amateur or professional, can operate up to 25% occupancy. Again, social distancing required. Alcohol sales are permitted, but there are several restrictions one will need to be aware of at these events. Event centers and reception halls can operate up to 25% of occupancy or 75 people, whichever is less. All other businesses can operate up to 50% of occupancy. Again, social distancing required. Waiting areas closed except for restrooms. And in regard to crowd sizes, for a single indoor event, 25% of occupancy is permitted with a maximum of 75 people. But for an outdoor event, and if you're unable to maintain social distances, is a maximum of not more than 150 people allowed. There's been some good news with regard to the vaccines now. At least two companies are just about to the point where they can make their products available for sale, and that's Pfizer and Moderna. Both of them are supposed to be around 95% effective, and the Pfizer is a little bit more complicated in distribution of it, since it's got to be transmitted at around minus 94 degrees, but the Moderna can be stored and transported in much less strict requirement. But both should be available by the end of the year, and the powers that be are determining now the priorities for distribution. One would think that first responders and the medical staffs and nursing homes and people like that, and high-risk people would probably be first, and then the general populace sometime later on, probably in the spring of next year. So that is good news. However, there is concern that many people may be somewhat reluctant to take the vaccine once it is available, fearing the possible side effects. But the tests that these vaccines go through are supposed to be, they've looked at all the potential side effects, and they've had large-sized populations that they're using on, so they're supposed to be highly effective with minimal side effects, and people will be urged to take the vaccinations when available. The state has, our state has recently regressed in the rate of positive tests. We were doing pretty good around the 8% level, but now recently it was up to 12.1. So that, along with what's happening in our neighbor states and all over the United States, as a matter of fact, has resulted in much of a severe increase in the number of cases, hospitalizations, and deaths. And part of our problem, as a matter of fact, is the states next to Louisiana are having bigger problems than we are, but that's spilling over into our state and affecting our rate also. On November the 12th, the House of Representatives for the state issued a petition trying to limit the governor's authority to manage pandemics, and that has gone through the process now and has been reviewed by a 19th Judicial District Judge, and he has sided with the governor, saying that the petition was unconstitutional. The state attorney general agrees with the House of Representatives, and one would expect that he will appeal this decision by the judge, and it will probably end up in the state Supreme Court for a final decision. The governor has repeatedly stated that he had followed the advice from the National Coronavirus Task Force, the Center for Disease Control, and the Louisiana Department of Health to guide him in his decisions, and he warns that to abandon the efforts that we are doing would jeopardize the lives of our people and the gains that have been made. So the recent surges all over the United States, and in fact all over the world, should make it clear to almost everybody that the threat is very, very real, and no one, absolutely no one, can assume they will not catch the virus. It's been said that some 40 to 50% of people are asymptomatic, but the virus is within them and it can be spread by them causing illness and death. Also, it's the age group of the 18-29, the young adults, are still a part of the problem in the numbers of positive tests we're getting. The governor has directed, even though it's controversial, has directed that every individual in Louisiana 8 years of age or older shall wear a mask covering the mouth and nose. And this is also applicable when one is either on public or commercial transportation. And is also recently the Center for Disease Controls have determined that children as young as 2 years of age can contract and transmit the disease, and they are recommended even children that young wear masks. In early November, the Louisiana Office of Alcohol and Tobacco Control and the Louisiana State Fire Marshals just reaffirmed to the state businesses that both agencies will continue to conduct compliance enforcement of Governor Edwards' recovery orders that remain in place. So just be aware that the state agencies are looking for compliance in accordance with the directives in these proclamations. So what can we do as a community, as a state, until we get the effective and safe vaccine available and used? Well, the first thing we should do is follow the prevention and mitigation protocols. That can't be stressed too hard. We simply must do that. Next is get the flu shot as soon as feasible to help prevent the problem of compounding the problem of having flu season concur at the same time as this COVID-19 epidemic. So we urge you to take the flu shot as soon as possible, and when the vaccination becomes available, it's urged that we all take the vaccination. For it to be effective, we got to use the vaccines that's been developed. The governor continues to say it's incredibly important that we follow these mitigation procedures, and they are, as I always do, I want to remind all of us, simply wear a mask. It's not popular, but it is effective. Wash your hands for at least 20 seconds. Cough into the bend of your elbows. Do not touch your face. Disinfect surfaces that are touched frequently. Social distance at least 6 feet. If you're sick, stay home and follow the advice of your medical provider. And as always, avoid crowds of any size. Most medical experts are saying that with the increase in positive cases as the cold weather consumes and more people are staying inside, it's only going to get worse. And they are concerned about the spread of the virus through smaller groups and such family events as weddings, Thanksgiving celebrations, Christmas, and so on. Schools and colleges on break and coming home. So they almost universally stress to follow these mitigation and prevention procedures if we're ever going to stay ahead or get ahead of this virus. So, ladies and gentlemen, our next scheduled briefing will be Thursday, December the 3rd. And I thank you for continuing to participate in this fight against the pandemic. I hope you have a happy, safe holiday. Follow the mitigation and prevention protocols, and we will brief you again a week from today, or rather a week from tomorrow. This concludes our briefing for today. Thank you and good day.